So welcome everybody. Let me switch on my video. So welcome to this webinar, and thank you for giving us the next 1 hour of your time. And we sincerely hope that you find this session exciting and something to take away, and to continue this conversation beyond this session with us. I'm really excited to share that we are in this webinar. We're going to have sort of two threads. The first part, where I'll be taking us through the journey of DIVOC, which is the platform that we have developed to issue verifiable credentials, and its journey over the last 24 months or so. And then our Director of Partnerships, Neeta, is going to take you through an interesting roundtable, which is a conversation with 3 thought leaders. And she'll be facilitating this conversation on what the potential verifiable credentials hold for the future to solve real problems for real people. We will be taking questions on the chat. And if we do have time, we can do a Q&A as well. But so please put your questions, comments on chat, and we'll try to respond as much as possible. So on that note, welcome again. So I'll start off. I am Pradipta. I lead the health team at EGOV Foundation here. And I'll go back a little bit to the journey of DIVOC, how it started, all of that to brought us to this point today. So a small introduction for those of you who don't know EGOV Foundations. We are a 20-year-old not-for-profit who have started on this journey to work with governments to drive national scale digital transformations. So there are 3 key areas in which we work. We create open digital platforms. We build a government capacity to make sure that they get the most out of those platforms. And we also help develop a market ecosystem and partners who will work closely with the governments for the long-term sustainability of these products. We work in 4 thematic areas, really: urban governance, public finance, sanitation, and health. And all of this sort of towards the following SDGs that you see on my left. We have worked with 6 national governments and 16 subnational governments in India. And DIVOC especially have sort of enabled 2.3 billion COVID-19 certificates till date. And our other platforms have supported over 250 million citizens. We are supported by philanthropy that you see, on below. So where did DIVOC start from? So this idea that, this really started with COVID, when, COVID was raging back in November. And we knew that, to meet the vaccination needs, to orchestrate a large-scale public health program like the COVID-19 vaccine program, we needed some kind of a digital backbone, because this was unprecedented. We had never done globally vaccinated so many people in such a small time. We have historically vaccinated children under 5, and here we were attempting to vaccinate everybody but the children under 5. So this was a massive endeavor, and India being a country of 1.3 billion people, you can imagine how big of an endeavor this was for us. And we needed to do it quickly. We could not, I mean, people were dying. We had to open the economy up. People were suffering from lack of economic opportunities. So this all had to be done very, very quickly. And that is why we knew that at that point that we needed something which was digital to help drive a program of this scale with speed. And that is where the idea of DIVOC was born. And the approach that we took from day one, that this should be able to work at scale. And that means that, from few thousand vaccinations a day to, over 10 million vaccines a day. So it should be able to scale for different countries and different contexts. It was digital first. We were building it based on what we were learning and realizing from the field. And it had real-time observability. We had analytics that was giving the program managers the ability to see how many vaccinations were happening in a day, which areas were sort of getting covered, where there were challenges, etc. So all of that information was quickly available at the for the program managers driving this program. What we were able to do as part of the work that we did was this gave birth to the vaccination certificate, which now has become sort of the hallmark, in my opinion, of not only trust. So this, but also this was the first time where people didn't have to stand in line to get their vaccination certificates. They could get it downloaded, from websites. If they were not digitally literate, they could get it printed. So it was just available to everybody at any point in time, whenever they needed to access it. This also gave governments the ability to roll out such a large scale, digital documentation for its citizens that was actually trusted by 190 countries globally, without having to spend a huge amount of money. And as I said, that, from day one, we build it in such a way that it's inclusive. It's available in multiple languages. So this sort of became sort of a way where, first time we were able to showcase that, digital documents can be trusted. It can give people, the agency to get a government document at the click of a button whenever they wanted it, right? So I think because of that, we were really able to scale up this, this became sort of the default vaccination certificate system that countries used. 5 countries across the world have used this to generate over 2.3 billion COVID-19 vaccine certificates, right? And that's also, in a way, a testament to the design and architecture of this platform, because we were able to scale up without any hiccups. So that sort of validated, the principles that went into designing the system. And the other thing that happened was that in each of these countries, we worked with a varied ecosystem of partners with which we could sort of interoperate with. And in each country, between the time the country decided to use the tool to the actual deployment and the time that they could use it, was somewhere between 6 to 8 weeks. In parallel, I think one of the things that we were doing was also making sure that we were sort of contributing and part of the WHO-led forum, which was determining the specifications for this digital certificate. I think that group came together fantastically. Rajesh, who's a panelist, was part of that panel. And again, because we were specifications driven from the very beginning, it again made it very easy for countries to sort of embrace this certificate and accept it as well. We are the platform is a digital public good as well. So when we as technologists, we sort of think about platforms and technology, but we started really thinking about after COVID sort of became less of an issue. Hopefully that continues to remain the case. But we started thinking about what is the power, is there anything beyond COVID, right? And here I wanted to tell you a story about this lady called Latiben and her missing nursing certificate, right? So this is a lady who we came to know about this woman a few months ago when we were brainstorming internally. What is the power of VCs to solve real problems, right? And this is a lady who sort of went to nursing school after having moving out of a really bad relationship with her husband. She wanted to make something of her life, and she went to nursing school because she wanted to pick up the skill and be independent. She finished her course, and for about 2 years, she was not able to get a completion certificate from her institution. She went from pillar to post till, and we came to know because we just so happened to know that this was a friend who was a senior bureaucrat who finally was able to help her get the certificate, right? And that's where, what we think is, and that's part of the roundtable this afternoon, is we think that, the power of verifiable credentials could really help a lot of people like Latiben to get these certificates with her at the time that whenever she needs it, without, like her having to, go through that negative experience. And she actually lost 2 years of her life because she finally got her completion certificate because some senior bureaucrat helped her, but that was 2 years too late. And that is the 2 years when she was not able to earn a living for herself. Right? And this is sort of, we want to leave you with, and we want for you also to sort of start thinking about what are those potential areas where something like this can really solve problems for people like Latiben. So let me go back to the platform and how the platform has over this period sort of tried to fulfill that, the needs of people like Latiben. So when we started with the first release, I think that was very COVID-19 vaccination specific. We also build out, a citizens portal from which people can download their certificates, other applications, apps where people could, like facility portal where somebody sitting at the vaccination center can print out a certificate. But it was very core vaccination certificate specific. Then the second release, the major release that we made was to look at efficiency gains. How do we reduce the time of, setting this up? How do we make it easier for countries to make, changes to the system as and when they need it, so that they have more ownership and they have more control? Release 3 is really about reimagining this for beyond COVID and just making this available as a more generic, verifiable, a platform which multiple departments can use to generate different types of verifiable certificates. And I'll come to and how that will happen. So before this release, every time you had to set up, issue a verifiable certificate, you would have to set up one instance of DIVOC. And for every type of certificate, you would have to set up a separate instance, which was cumbersome, which needed a lot of, which needed more manpower, human resources, and which was also a little harder to support. But now with this current release, I'm really glad that we have, one government can issue different types of certificates, as you can see on my right-hand side, whether it's a nursing certificate, a doctor's certificate, a clinical certificate, different types of certificates can be created and issued from the same system without having to have multiple deployments, multiple setups, etc. It also gives tools to countries to set up these types of certificates, to define their own schemas, and so that the country teams, the teams themselves, can do a lot of this work through a UI-based wizard. On that note, I will end here and I will hand over to my colleague Neeta, who is going to now facilitate the roundtable conference.
Thank you, Pradipta, for such a wonderful presentation. I think the logical next step here is that the question is, how does one mainstream these valuable assets to solve real world problems for the likes of Latiben and many more? And so for the next session, please join me to welcome our speakers for the roundtable. Extremely honored to have Dashun Hegoda from ICTA Sri Lanka. ICTA, which is the Information and Communication Technology Agency, it is an apex government-backed policymaking body under the Ministry of Technology and is entrusted with guiding Sri Lanka's digital transformation journey. Dasun represents government policymaker in this roundtable. Rajesh Menon, as Pradipta mentioned earlier, has worked extensively in an open ecosystem of verifiable credentials. He currently works with Foundation for Interoperability in Digital Economies, and he's representing open source community today. And then join me to welcome Junius Ho. He's the co-founder and chief product officer at Affinity. Affinity is a VC ecosystem infrastructure provider, but use case driven. So Junius is representing market here. We will now hear their perspectives on their roles. I will stop sharing my. So we will now hear their perspectives on their roles, their experiences, their challenges, and their wish list from each other to spark this conversation and suggest a way forward on how VCs can be mainstreamed. What will it take to unlock access to services and empower individuals and communities through control and ownership of their data? I'm going to start with Dashun, with you, because government is the main provider and the issuance platform really, for VCs. And as an early adopter of DIVOC, and in the context of Sri Lanka's digital transformation journey, can you share with our audience your experience with verifiable credentials? What role you see for policymakers in creating more policy hooks and to enable use cases beyond COVID? Over to you.
Thank you, Neeta, for the introduction. And I would like to congratulate DIVOC team for releasing version 3.0, because I'm truly happy to see how DIVOC has evolved into 3.0, where Sri Lanka is an early adopter of DIVOC. So Neeta, before I answer your question, I'll give a small background about our journey in Sri Lanka with the DIVOC team. We have an enterprise architecture for the entire government, as well as digital transformation strategy formulated by ICTA. So like you said, ICTA is the apex policymaking body who are entrusted with driving the digital transformation in the country. So in our digital strategy and the enterprise architecture, we have identified key domains. So health is one such key domain to be digitized. So in that domain, we have identified verifiable credentials as a key focus area to enable digital transformation. So let me tell you why. Because when we use verifiable credentials, if you use verifiable credentials, those credentials can be instantly verifiable and they are tamper-proof. They are portable. You can take it anywhere in your mobile phone, a computer, even you can have a printed certificate. And you can do a seamless verification without any delays. Most importantly, the certificate will be cryptographically signed, so can be verified in a secure manner. So enabling us to build security and trust as a government body or as a government organization, because that is paramount for us in our digital transformation journey. So with all these features, that's where the DIVOC comes into the picture. So our smart vaccination program is completely powered by DIVOC. Our smart vaccination program is the proof of vaccination for all Sri Lankans needing to travel overseas. I remember we started our journey back in 2021 March. Within 4 months, we were able to do a national scale deployment. So that shows the agility the DIVOC has and the agility the verifiable credentials has, even as a government body. Through all these administrative processes, through all these approvals, we were able to do it quickly, even during the pandemic time. So I think that would be a good example for us to do to mainstream verifiable credentials. So I'm happy to say currently we have issued more than 1 million certificates. We issue 1,500 to 1,600 certificates per day. On top of that, I must say, so these certificates in Sri Lanka, we issue the certificate in trilingual manner, customizing as per our country requirement. So that has been the journey. Most importantly, the platform has been W3C, based on W3C verifiable credentials, which brought the degree of standardization as well as open specification, allowing us to do cross-border integration and verification. So in other words, it reduced the fragmentation in the ecosystem. So as a citizen-centric government, so these are the real problems and that we are trying to solve for our citizens. So looking ahead, what I would say is with the success of the DIVOC implementation, we are planning to expand our implementation into health sector, as well as not only that, to other sectors also. So in our health enterprise architecture, we have 3 main registries: provider, patient, and facility. So all public sector and private sector hospitals will be using these 3 registries. So we are planning to use Sunbird RC for these 3 registries. It will be vital for us to implement these registries. Currently, we have completed the requirement gathering phase. The requirement is yet to be signed by Ministry of Health. So we'll be going ahead to a POC, then to a production rollout. So not only that, we will not stop there, and we are having internal discussion to how we can implement credentialing in education domain. A low-hanging fruit would be to have credentialing in certificates. In Sri Lanka, we have 2 major exams, ordinary level and advanced level. So we are planning to issue certificates through credentialing for those 2 exams. So those are under discussions also. So I would say, summarizing everything, mainstreaming verifiable credential can reap benefits for government as well as citizens, because it increases the efficiency within the organization as well as in the ecosystem, and a huge cost saving. So most of the certificates, smart vaccination certificates, are issued online. Only couple of certificates are printed. That's what I see. And it has improved accessibility because my certificates is always available in my smartphone or in my computer. With all that, it has enhanced the security and privacy of the entire ecosystem because it is tested properly, and we have a good open source community around it and good adapters. So with that, I would like to conclude my session and hand it over to Rajesh. Rajesh, how do you see open source community can bring value to the ecosystem? Thank you very much.
Yeah, absolutely. Thanks for the question, Dasun. And before that, thank you for inviting me to this webinar, Nathan, Pradipta. I've been fortunate enough to actually work with all of you, as well as my foundation colleagues in this entire journey for the past couple of years. And there's a lot of interesting insights that we've actually gained right from not just building the asset in its entirety and trying to put it to population scale use, but also trying to bring in a degree of standardization across the board so that these assets aren't just stuck into silos, and they have to be, for them to have applicability beyond borders or beyond jurisdictions, it has to be by definition interoperable, right? So how the standardization exercise actually contributed to widespread adoption of this particular digital asset, at least to begin with in the case of COVID, and now increasingly as we see it in multiple sectors, as you rightly said it, Dasun, has been a fascinating journey. Some of my own specific learnings by being part of the open source community. COVID actually gave us a reason for all of us, governments, market participants, as well as contributors from the open source community alike, to come together and actually try and figure out a way by which some of these instruments have use beyond serving the immediate requirements of making sure there is mobility of people across jurisdictions or borders and so forth, and also try and see if instruments like this could have use beyond the specific use case that it was meant for. It started off with a very specific need for addressing COVID-related interoperability needs as such, specifically since borders were being shut down, there were lockdowns across in most jurisdictions. But at the same time, as vaccinations scaled up, how do we actually ensure that there is a degree of proof provided to people so that people could use that instrument and actually use it to freely move around within their own local economies of sorts, so that the economic activity could also kickstart and the national engine could get back to where it was pre-COVID of sorts. So our entire intention was to get to a state pre-COVID of sorts. And for that, we needed an instrument like this, and VCs provided us with the perfect alternative, wherein we could actually have something like a simple digital asset, digitally signed, as you said it, with cryptographic keys and so forth, but also holding the data set that proves the status of the person in a very frugal way, obviously with very limited costs and so forth and all. But at the same time, also ensure that people could use that as a mechanism to start having portable records at their disposal. So that was, for us, was like a big eye opener of sorts, because historically, when we looked at even the health sector, and I've been part of many standardization exercises over the past 2 decades, for us, addressing the problem of interoperability was difficult because we couldn't necessarily crack the problem of portability, which is the reason why personalization of health records and consumerization of health records took a while before it could be built across the geographies as such. But when VCs came into existence, it gave us with the right alternative wherein we could actually have those micro data assets with specific health records, very purpose specific, but then issuance of more and more portable health records like this in the form of VCs, but which are also at the same time verifiable, even in resource limited contexts, right? So the whole, one of the most significant features of having a VC is to have its ability to read the information and ensure the authenticity, even in a no internet scenario. So the verifiability and the portability part of VCs is something that we believed could be like a significant game changer of sorts, and an influx of micro data assets like this in the form of VCs could eventually lead to multiple parallel ecosystems where more consumer health records, by aggregating these different pieces of information, and on top of that, more relevant and contextually insightful transactions could be built for citizens to have better health awareness and so forth. And also, we found that as a fascinating exercise. The first step in that journey was to build a degree of standardization, consensus across the board. And as Pradipta did mention, a couple of years ago, WHO anchored this work group, which involved experts across the board, government, markets, as well as the open source community. And we had a lot of churn within that, and ultimately resulted in a set of data dictionaries being put out, which gave us a semblance of direction, wherein we could use that not just to issue credentials at population scale, but also use it as an instrument to facilitate free movement of individuals between jurisdictions and countries and so forth. So that learnings have been particularly insightful. And once we see the adoption of VCs through multiple formats that exist today, like DIVOC being one, and a number of other parallel efforts in the US and EU and so forth, what we see is every regulator or jurisdictional authorities actually see this as an interesting engineering exercise to actually be adapted to other disciplines. So as Dasun, you said, if this is something that can work probably in the COVID context in health, why not education? Why not other health transactions and so forth? And also, the possibilities are limited. It would require a degree of standardization across the board, so that we don't necessarily create these kind of execution silos, so that becomes probably never gets addressed at all. But if we can manage that, VCs give us a wonderful pathway to make sure portable records, which are contextually relevant for citizens, could be built along the way. And from that perspective, the open source community, we are, there's been many voluntary contributions across the board. There are a lot of innovation happening. Some of the earlier efforts around W3C based data dictionaries for VCs are now seeing more and more parallel efforts into defining more schemas, more dictionaries, and so forth, and all by various methods. So there's a lot of innovation that's actually happening in this domain, and we are absolutely thrilled to see this contributions go forward. So with that, I conclude my opening remarks. I hand it over to you, Neeta.
Sure.
Yeah.
Thank you, Rajesh, for sharing those thoughts on the role of open source community here. And I think the key stakeholder here is probably Junius yourself, who represents market. What has been your reaction to the evolution, as you see, of the VCs? And talk to us about some of your products that you have. Basically, they're the ones you are in the business of creating value from these digital assets. So I think we have a lot of people in the audience who would really love to know from your perspective. Thank you.
Perfect. Thanks, Neeta, and thanks, team, for having me today. Super exciting to see the evolution of DIVOC, and congrats to the team on the 3.0 release. I think really makes things a lot more accessible to develop new solutions, to deploy new solutions. And I think that just is a win for everybody that has seen this and been a part of it. Our journey at Affinity started 3 years ago, so before COVID, and it started with the idea the vision of unlocking data, reversing data ownership, and then making that portable so that you could find new opportunities and access new opportunities and not be restricted by borders, whether they're physical or digital. And it was a relatively new idea. I think it was a sort of the fringe thing. This is prior to the explosion of Web3 and all of these types of things. But I think we always had the belief that you said at the top of the hour, we had to solve real problems for real people and real businesses to drive this forward. And our kind of one of our first companies that we work with was Good Worker, who I think very apropos to the original sort of nurse skilling, it's a job matching platform for blue collar workers. And the challenge being that they don't have formal records. And because of this, they don't have the LinkedIns, they don't have the CVs or the formal degrees that we are very fortunate to have. So how do we empower them? How do we leapfrog from paper to just these verifiable digital credentials? And that was happening until then COVID, of course, happened to all of us. And I think what was really interesting was the collaboration between public sector and private sector. So in India and across multiple countries like Sri Lanka, you had the DIVOC efforts of creating this new standard. In the EU, you had EU DCC. In the US, you had smart health cards. And it was the greatest movement of digital issuance and credentialization of citizens and people in the history of the world, right? And the challenge was that on the other side, how do you accept all these different standards? How do you create something that universally makes it portable? And this is where we started working actually on our COVID solution, which was a universal verification solution that said it doesn't matter who you are, where you come from, what type of certificate you bring into an airport or onto an airline, we can read that. And not only that, we sort of solved the fragmented kind of standards and solutions, which look, eventually we know we'll get to a single standard. But in the meantime, the problem that the passenger has is how do I make sure I get to the other side to see my family or to conduct critical business? The other part we coupled with that is anyone that in the audience had to travel during COVID knows that you needed a small specialized degree, I think, to understand what all the restrictions were, and this fear of, hey, if I cross the border, am I able to get on the plane? And then if I get on the plane, can I enter that country? And then once I get there, can I come back? Well, we helped pair that with sort of the rules and the policies to make it super easy for immigration and for passengers to be able to cross borders freely. So I think this combination of verifiable credentials, this opening up of data from governments, and then industry working with customers and solving real problems for people trying to get across borders, I thought was just this brilliant use case. I think obviously COVID wasn't great for the world, but it was really great for verifiable credentials, right? In terms of pushing the technology and bringing that need to the forefront. So what have we done since then, right? It's similar to at the top of the conversation, what next? And what that really drove, now that people understand the power of a digital credential that's verifiable, that's portable, right? That's tamper evident. This then it's like everyone could start to see the other possibilities. So I just wanted to kind of talk about two of the specific things that we're working on. One, we'll start with India, where our product called Asli ID, which is essentially a credential wallet for blue collar workers. So it starts with whatever job experience they have, skilling. We've partnered, of course, with also LearnNet to sort of say, look, how do we onboard both potential workers, maybe even freshers, folks that have taken courses? How do we give them that formal record, and how do we start helping them find jobs? And when they get those jobs, how do we make sure that we credentialize their pay stubs so that all these proof points of, hey, I'm someone that put myself through a skilling program, I got a job out of that, and I also am looking to improve myself and looking for that next job, proving all of that out in a verifiable way. In fact, it's actually ironically, or not ironically, but interestingly enough, even more verifiable than what you would see on LinkedIn, right? So I think the power of these, the DIVOC technology and any issuance technology, really, like, one of the things I want to emphasize here is Affinity's approach. And I think this is really important for the industry folks out there. We're open to partnering with anyone who's looking to open up that data to unlock that data. The new internet does not work. The new system does not work by locking in data and making it tough for individuals to switch out. This lock-in thing doesn't happen because essentially what we do is we give all that data to the individuals and then we integrate with individuals across the world, right? Instead of integrating with each other and all these different companies and having end-to-end integrations, it's just one, because that end consumer, whether it's that worker or a patient, as the Shun talks about, they're the one that is moving through the context, right? A company doesn't go from Sri Lanka to India to here I am in Singapore, and then doesn't connect to Uber and to Grab and to all these ride-sharing platforms, but a person does, right? So when they go with their data, when they can take their data anywhere, their data can be universally accepted and verified with VCs, it becomes super powerful. So the second piece I'll talk about, and then I think will be some interesting conversations of what can each part of us sort of representing open source government and private sector or industry do for each other. The next one is health, right? And I think this one is building off our COVID product, but we looked at something called Health Pocket, and essentially, as Rajesh was talking about, portable medical records, it's a health wallet. But we didn't start with saying, hey, let's just build a consumer health wallet. We went to hospitals, we went to hospital systems and said, look, what are the challenges you had? And while we're sitting there, we're observing, even in a super advanced kind of economy and society like Singapore, there's people just waiting in queues. And as we talk to patients, they say, hey, I wait in this queue to check in. I check in on the first floor, they send me to the second floor, and I check in again, right? And this after a specialist sort of referred them with all this information, and none of that information, it's all potentially the same hospital, same system, it just doesn't talk because there are all these silos. So now we give that patient in Health Pocket all that information, we digitize that, so we solve some of these forms issues, and then all this information moves and adds through and makes the lines go away, make sure information isn't inaccurate or doesn't get lost. And we're starting to build on top of that as well, looking at a borderless care product, right? Because it's all about a seamless journey. At Singapore here, quite a few people come from other countries like Indonesia to get care. How do you, are we going to talk to an Indonesian hospital and a clinic here in Singapore and talk about an integration? Or are we going to say, hey, here are some patients, integrate with these patients through verifiable credentials and other things, and we're able to sort of give that seamless, great patient-centric, Dashun talked about citizen-centric, right? When you're a patient, that's a different context, but how do we make it just as seamless? And I think in all the things that you're listening about, like a lot of people focus on the technology, right? We don't lead with verifiable credentials. We sort of say, hey, here's the problem we see, here's how we'd solve it. And of course, people are like, this sounds kind of magical. I don't know if I really believe you that you can make this happen, but then you can explain how this technology works. And the best part about this is with DIVOC 3.0 and a lot of the other initiatives, it's so much more accessible to developers. Our primary customers are developers, right? Whether it's in the open source community or in the industry sectors, but enabling them to build customer-centric, consumer-centric apps with portable data that makes it privacy preserving and more secure, because now you're not having multiple products or multiple copies of that data. It becomes super powerful, right? I think one example, last example I'll give, and I'll throw it back to Nita. Nita, the airlines do not want to store health data, right? So I need to verify it because this is what government requires me to do, but the last thing I want is more data that could potentially be breached, right? And by bringing your own data and then taking your own data with you and just using it at that point in time, it's such a powerful, powerful idea. So really, really exciting to kind of see this space evolve over the last 3 years. I know there's still work to be done, but just the amount of progress in the past 3 years has been incredible.
Thank you, Junius. That's wonderful to hear from you on the possibilities. And we saw both in terms of health and otherwise other areas. But I think for you to create this value, I would like to know what is your ask from government and policymakers, because today we have a lot of them joining us on this call, and we have the Shun as probably representing them. So if I may ask, what will make these sustainable business models, right? And I think that'll be really nice to hear from the Shun as government, from Rajesh as an open source community. If you have anything, that'll be great to, floor it here.
Great. So maybe I'll start with kind of my ask. I think alluding to the openness by which we try to run our business and partner, I think opening up the data so that the citizens are able to use that in different contexts, making it super easy for them to do that. That's so key, right? And of course, there are privacy and security challenges and things like that. So I suspect there might be some asks coming there to the industry sector, but it starts where we lead by example. And I think with DIVOC, this 2.3 billion credentials, it's such a massive number, right? And it shows such a powerful use case. How many other billions of pieces of data can now drive completely new economies, completely new business models, and new opportunities for citizens, not just domestically, but internationally, right? As sort of borders have become, well, interestingly enough, it's been cyclic, right? They've opened, they've closed, and now kind of opening back up, right? But that's number one. That's one ask, is kind of looking at how to open up that data. And second, I would say really explore from a citizen proof point perspective. Run pilots, experiment. You don't have to necessarily do it at scale, but the best way to learn on how a new policy should come together is to actually have firsthand experience, right? And I think there's a lot of assumptions that I came into affinity with and into this space with that have just been completely blown. And I tell you now of like opening and creating a universal verification product as it's so easy. But at the time, it was really hard, right? To think differently, because the platform thinking that the current business models say is all around like, no, we must capture and we must own the end consumer, we must own the citizen. Well, the government doesn't have to worry about that. And the government and policymakers are the ones that are looking out for and trying to make accessible the world domestically and internationally for its citizens. So those are the two asks. Like, one is to open up more of that data. And then second is to really just experiment with real world use cases.
And I would just add to that, Dishwin, I would invite you to respond to that. I think it's also important to create those policy hooks, which is pretty much on experimentation, but government is the biggest, for citizens in terms of helping them, unlock this value. Because if a product is made, but it is not accepted, there are no policy hooks, it will be impossible to create that value. So I think our question here would be to you, is this really complex? And what has been your experience? What would be your advice to governments internationally?
Thanks, Nita. Thanks, Rajesh and Junis, for the brilliant insights. Very helpful. So, Nita, to answer your question, no, it's not complex, but it is to a certain extent, because let me tell you why. Because Junis himself said the new internet does not work when it is locked down. But as a government, we are trying to address real problems, real citizens, most importantly, real assets and real data. So as a government, we are liable and responsible to protect the assets and the data of government citizens when we are integrating or when we are collaborating with the private sector or any other third party. So that's where the data classification, data service classification, and the proper governance comes into picture. So yes, I also truly believe that collaboration is the way to go, because the more the adaptation we have in the private sector, it will be good for us as a country, because the job of the government should be to make policies and empower the private sector to drive the businesses. Government should not compete with private sector. Rather, it should enable and empower the private sector to do its own business. But to do that, as a government, what we should do, I think we should bring open community, open market space that will enable open innovation within the country as well as outside. So what I believe is what we should do as a government is to put in place a proper governance body or a procedure through policies, processes, and procedures which will enable private sector to build their products to serve citizens better. So that would be my take. Thank you very much.
Should I go in next?
Yes, Rajesh, any
Yeah,
final
sure.
words that you may have? I think.
Oh yeah, I mean, I'm intrigued by what I heard from Junius and Dasun. I couldn't, in fact, stress on that enough. A lot of the things that we actually learned from even COVID. I know we had this pressing need of ensuring proof of vaccination status documents are actually issued to people at scale. But at the same time, one thing, if we were to look back and see what else could we collectively have done better, is probably have nimble-footedness at the part of policymakers to also make sure the policy infra also moves at the rapid pace at which the tech ecosystem was evolving then. That's probably one learning I would like to push through, hopefully, as we start branching out into other subdomains or segments and so forth. And also, as Dasun rightly said, governments are best served at defining the right policy infra, the digital infra for issuances, verifications of VCs to happen at scale, and the entire value creation segment at the market level, where juniors and colleagues could actually build a lot of combinatorial value assets derived from VCs. And there's a lot of innovation happening in this domain. It's not just VCs alone. There is a lot of open wallet, interoperable pilots that are actually underway right now, which essentially will break down some of the key ideas that Junior spoke about, like cross-border health care products and so forth and all. How do you allow seamless movement of information between borders and things like that? So having VCs, having verifiable presentations of those VCs enabled through wallets, and having wallets themselves open and interoperable by core design are all innovations that the entire innovation ecosystem, open source as well as the market, is actually moving hard thrust into. And if the government can also step in as a contributor, participant, as well as an enabler of this ecosystem with the right policies in place, then I think we will probably see the real, I mean, a lot of these use cases actually come to life, and the real social value derived out of these instruments down at population scale for all citizens to benefit from. So my one call to action for both market and government would be that, collaborate with the likes of us. I mean, we are all part of the same innovation ecosystem anyways, but some of the newer ideas that are actually emanating from the VC world, from the open wallets world, if we can all partner and participate and probably even do execution pilots and experiments, as Junius said so, let's give it a shot. There is a lot of value that could be derived out of that, and we could run small limited scale execution pilots and see what value can be derived out of that and impacts the citizen at large. So those are the ideas that could be scaled up. And how the world experimented with VCs, there are probably a larger ecosystem out there that the tech world is actually trying to put out with the combinatorial forces of everybody involved. So these are very exciting times, and we couldn't have this webinar and discussion done at a more opportune time. So with that, yeah, that's pretty much my remarks as well. Neeta, over to you.
Thank you, Rajesh. Very well said. And what an exciting conversation. I think two things are very clear. One is the role of verifiable credentials as digital assets in the digital journeys of nations, as Dashun kind of, said. And I think increased level of trust through a continuous dialogue to negotiate, how best digital infrastructures can be set up, policy hooks can be created by the government, how the universal acceptance can be facilitated by open source, and obviously the combinatorial value that is created by markets through sustainable business models. So the chime of the clock forces us to take your permission to say goodbye. We thank our esteemed speakers for making such an engaging session through an open dialogue. And we thank each one of you here who has been with us today, hoping that you will continue to build on this conversation through your ideas, through your suggestions, through your questions by writing to us or facilitating similar webinars, I would say. Sorry, this is the, and you know, globally sort of having similar dialogues and inviting us to join in. So thank you very much. And please feel free to write to us on the email IDs shared here below. Thank you very much. Bye-bye.
Thank you. Thank you.